Good evening, everyone. Wynn Brown here with Heywood Healthcare's COVID-19 update for the afternoon of Wednesday, the 28th of October. Rainy, cold fall day, and I hear we might get some snow, maybe even on Friday. So it's hard to believe that it's already coming upon us, but 'tis the season. Here I am with giving you an update. First, going right to our rates. Our positive rate, cumulative positive rate is 2.3% versus the state at 2.6. So we are under the state right now. For our 7-day rolling average, we have increased to 2.51%. And that has far surpassed the state at 1.7. I can tell you, I get updates daily on the numbers of positive testing that's coming through, and it really is a little bit scary. And we really need folks to do everything that I'm going to tell you to do later on in this video. But as far as staff testing goes, so far we have tested 1,183 staff with 1,228 negatives back so far. We did have an additional positive staff member test positive, which we have traced to be community acquired. That staff person is at home and per our protocol. In the statewide numbers, we have tested a total of almost 5.8 million, which represent almost 2.7 million individuals and almost 150,000 positive detected cumulatively throughout the pandemic. Let me just go down here and see what else I have for you. I didn't have it all teed up as well. Oh, I know the past couple times I forgot to tell you the inpatient census for COVID positive patients. And as of this afternoon, we have 4 positive COVID patients on Watkins 1. So that's where we are right now. So we are again seeing an incredible positive trend upward. And so since Sunday, the last 4 days, we have had 36 community positive tests come back, 16 of them under the age of 25, 7 under the age of 12, and the average age of 35.4. So really it's our younger population that is contracting COVID. And so that's just what we see going on across the country. And just want people to know that. So 44% of the community tests for this week alone have been in cases of people under age 25. Okay, so to our younger population, I hope if you don't hear this, one of our staff members or your family members will tell you you need to be super cautious and pay attention to all the things that you need to do. So just a reminder to our community and to our patients, really around pediatrics first. Very important that all our kids stay up on their vaccination schedule. And during the first wave of the pandemic, vaccination rates dropped. We need to continue making sure that everybody who needs the vaccinations on schedule get that done. They're an important preventive measure. Hopefully everybody is also getting their flu shot, whether it's at a local flu clinic, in one of your practices affiliated with Heywood or one of our independent practices, or at one of the local pharmacies that provides them. I know that there's been a huge uptick in demand and the supply has been rather tight, but please continue to look to make sure you get those. Also, if you're not feeling well and you don't want to come in for an appointment, just know that all our providers provide telehealth visits, and that's something you can discuss with your physician if you'd like to do it. You have your visit that way. And just to let you know, at Heywood and in our practices, we continue to sanitize everything daily using the highest standards of cleanliness and use our UV robots as well for disinfectant across all parts of our 2 hospitals. And so just know that is available as well, and we're making sure that you have a safe environment for care. We also have restricted visitation going on and continuing to go on. And so, for inpatients, really someone's on comfort measures only, end of life care, or some other extenuating service situation, or if it's a pregnant mom and she wants a support person with her, we allow that. In that situation, if it's someone going to be on a maternity department as a support partner, they are also tested for COVID-19 because they'll have an extended stay on the unit in close proximity to a lot of people. Some new news tonight, and there will be an all-staff email going out later today, but you heard it here first on the COVID-19 update. We are going to move to make sure that all of our break rooms only have 1 person at a time eating in them. You might have seen that Holyoke Hospital actually made national media for its outbreak that it recently had and tied it to employees eating in their break room. So you can have more than one person in a break room if no one's eating because their masks are on. But just out of abundance of caution, we are going to require that only one person can eat at a time in our break rooms. We understand that this is a hardship on our staff. We have opened up both cafeterias all day long. They used to shut down 1 or 2 times a day for changeover in meals and staff, but those are now open to provide more access. So I appreciate our food service staff in assisting with that. Just a memo from Andy Patterson that he sent to the staff of the medical group. He writes, we implore and require you to eat in peace and eat alone at work. To help with this, we ask, implore, and require that you eat in peace and eat alone at work. When you eat in break rooms with several employees at close distance without masks, we create an unsafe environment with significant risk for COVID exposure. We are limiting break room occupancy to 1 employee. So it's one of those things you got to tell someone 7 times in different ways. So we're telling you multiple times that starting tomorrow throughout Heywood Healthcare, only 1 employee eating in a break room at a time, and that might require that you change up your break schedules and whatnot to do that, but that's what we have to do right now. Andy also provides Andy's Nix It with six included 6 tips. Hands, wash them often. Elbow, cough into it. Face, don't touch it. Space, keep a safe distance. Home, stay if you can. Eat at work, eat in place, eat in solitude. Thank you, and I encourage you all to be extra vigilant to help reduce the spread, not only the staff, but people throughout the community who watch this as well, as we continue our journey to be one of the best community-owned health systems in America. Good night.